My name is Jessie Tierney. I'm a doctor of physical therapy, specializing in frequency-specific microcurrent, and I am here with Heather Gunther, who is a psychotherapist and nervous system coach, among other things, teacher, mentor, workshop facilitator, amazing human being. And we're just dropping in for a quick question and answer with Heather, with her expertise, specifically in how what her expertise is can support frequency specific microcurrent practitioners. Hi, Heather.
Jesse, great to be here.
Thanks for being here. Welcome. So the question for today is how can we as frequency specific microcurrent practitioners be trauma informed?
Well, I would say that I would push back a little bit on even like the trauma informed, because I would say that it's really about how do we be people informed? How do we be nervous system relational informed? Because that's really what we're talking about, because trauma happens when there's a break in relationship, and how we heal is in relationship. And so the real question then becomes, how do we look at relationships from before we even step into our office with our clients in a way that is offering what Alan Schore calls a neuroception of safety? So that ability to be able to help your cells and your perception of safety come together, right? So that way, when you're in this space, you're able to let your nervous system access some ventral vagal, right? Some connection, sympathetic, right? Some pieces of it's okay to be here.
Okay, wow, a lot in there because, okay, trauma informed is such a buzzword, right? It's like such a thing. Everybody's t talking about it, and it's like, how do we incorporate that? And you're saying there's more to it than just that. Can you speak to that just a little bit more? So like, so why call it something else? Or yeah.
Because there's anybody who's coming into your office is coming because of trauma, period. If you have an autoimmune disease, if you have any dis-ease, right, in your body, it is because your body is not working at its innate health capacity. And the thing that causes the inflammation, the thing that causes your health to dissipate is that trauma. That's what causes the biggest amount of stress. Relational challenges cause stress, whether that relationship is with yourself or whether that relationship is with others. It's in that that creates the stress that can then causes the inflammation that then causes all of the other things. So even if someone were to come in and say, well, I just broke my leg. Okay. If your leg isn't healing properly, that's related to stress. And that stress is related to either a challenge in relationship with yourself or a relationship with others. So you don't actually have anybody coming into you that's not coming in with trauma. And therefore, it's not about being trauma informed. It's about being human informed. It's about being relationally informed.
Great. Thank you for that like clarification. I think it's important because anyone who's undergone life is probably has an experience of trauma. And it's kind of like, how are we even defining trauma and all of that? But that's probably getting a little bit too off topic. However, so specifically in frequency world, we have PTSD protocol, we have vagus nerve and concussion protocol or nervous system reboot. We can target different parts of the brain and we have emotional factors and so on. So there is a lot we're able to support with the frequencies, but yeah, at least in my experience, sometimes, many times, that's not all it takes. Like if that's all it took, we could prescribe home units to everyone on the planet and we'd all be healed of our trauma. So maybe speak more about that.
Right. Yeah, absolutely. And what I would say about that is that we, there's two pieces to it, right? So one piece is the disempowerment of this is happening to me, this is saving me, this is rescuing me, this is right. And if we're in a state of victimhood, right, we're not healing, we're not in optimal health, right? And and we are our subconscious, our innate well-being will not allow us to heal from in a state of victimhood, right? Because if I give you my power, then I just perpetuate that I'm not powerful. And so I've seen it, right? Like, because I also work with the frequencies. I'm also an FSM, right? Person. And so I've seen that you can give someone the units, but if it's coming from a place of disempowerment, the change doesn't happen, right? And so part of our work as FSM, working with the frequencies is to be able to also know that it's the relationship that we offer and helping the client feel empowered. Wow, you intuitively knew that this was a path for you. It can be that simple. Like, wow, what is your body telling you? Oh, you don't really know how to know what your body is telling you? Great, we'll start there. Let's start with you being in relationship with your body and for that to be safe. Do you know where your toes are? Can you feel the difference between your left toes and your right toes? Oh, just doing that, and my body wants to start to yawn, right? Which is my favorite way of regulating, to spread out, to create space, right? To actually be inside my body and more with myself.
Amazing. Yeah, I think that this is such an important conversation because there are practice models where you arrive, you get hooked up in a room, you do your 30-minute, hour-long, whatever long treatment, and and that's well and good, and the frequencies do a thing, and there's the whole aspect of that relational piece. And I think the way that we utilize the frequencies with people by going, okay, I'm going to toggle between two options, and I want you to let me know if you sense a difference or if you have a preference. And maybe we're toggling between positive and alternating current, or maybe we're toggling between reduced inflammation in the spinal cord or in the peripheral nerve, or upregulating the vagus nerve or the parasympathetic nervous system. And that's a way, at least from my perspective, of how we can be doing our great work with the frequencies and recruiting our clients to be fully participatory and honoring their experience, and and also what I have found is a lot of the time it's the client telling me what they're noticing that is the aha moment in the treatment, in the whole treatment. So yeah.
And snapping my fingers because that's exactly what I was about to say next, right? So it's as simple as saying, what are you aware of? I don't know. Great. Lean into that. I don't know. Right. So from this place of I don't know, when you start to know, let me know. Right. Because it's in presence that we're actually in relationship with ourselves. And that is where we have access to health. Right. And the more, I mean, the amount of studies that have been done at this point, right? We know that mindfulness is what helps us access health. Right. We, there, I'm sure Jessie, the queen of research, after this will give you an entire resource list full of research that confirms this, right? This is not pseudoscience. We have a lot of data, fMRI studies and blood tests and the like that tells us it is presence that gives us access to health, literally from a cellular perspective. Our cells can fight off viruses and bacteria and fungus and all of the things when we have access to presence. And so that is the biggest gift we can offer our clients. That is how we
Yeah, say that again. Say that again.
are trauma. Right? That's how we are trauma informed. If we realize, relational breaks are what cause dis-ease, right? Lack of health. Presence is what allows is literally being in relationship with ourselves and in the present moment. That is what causes the health to come forward. And then the frequencies are being played as the person is reconnecting to their innate health. And then it amplifies that.
Fantastic. Yeah. Presence. It's simple. And as a clinician, as a busy, got 75 things going on at once, it's like, that's how do we bring that in? And yeah,
Your clients will heal faster the more they have access to presence. And so it's about shifting that mindset. It's not about the more you do, because you are not the rescuer. You are not the healer. You are the container that allows them to feel safe enough to be present with themselves so that their own health can come through.
fantastic. Wow. That's so powerful and it rings so true. It's so resonant. Um, yeah, and I hope that people really take this home and into the clinic. And I know from experience that doing these techniques that it's not even like a technique, it's just being, right? It's like an undoing of all the things. Um, is so, so, so potent and powerful. So thank you, Heather. Any last words about this before we close for today's session?
I'm going to reflect back what you just said, Jesse. The thing that I think is most powerful for practitioners is giving yourself permission to be present too, because presence is contagious. And they've done the studies at Harvard, right, with the mindfulness to tell us, right, presence is contagious. And when you as a practitioner are present and you slow your roll and realize I am the container, that creates the conditions for the frequencies and the other work that you're doing to be powerful, contributors to someone amplifying their health, right, and accessing it faster. So.
Thank you so much, Heather. What a fantastic conversation. And I can't wait to do this again with you. Thanks, everybody, for tuning in. We'll see you next time.